So why should we merge? Because we want to protect vital local services and improve health and healthcare here in East London. The communities we serve are some of the poorest in the country. We see this in the high levels of disease and poor health prevalent in this area. At the same time, each of our 3 trusts has huge areas of expertise, but like all other NHS trusts, we are having to do more for considerably less. We've got a rapidly growing and ageing population. New drugs and treatments are becoming more expensive every year. And we're caring for more patients with conditions caused by obesity, drinking and smoking. For all these reasons, our costs are rising faster than our income. As a bigger organisation, we'd share our resources and better tackle these growing health challenges. We could save money by cutting waste and duplication in some admin and backroom areas. Together, we could have immense buying power, saving, we reckon, at least £25 million every year by getting better value for money from our suppliers. Saving money in this way could protect our critical clinical services from having to make bigger savings themselves. The merger wouldn't just protect vital services, it would give our doctors, our nurses, our midwives and our healthcare professionals the opportunity to raise life expectancy and the quality of life for many, many thousands of our patients and revolutionise healthcare across East London.
I get excellent treatment here at Barts. To get here, it takes me an hour and 10 minutes, sometimes longer because of all this city traffic. But going to Newham, it takes like 10 minutes, quarter of an hour, which is a big difference in my eyes.
The potential advantage of the merger is that more patients may be able to receive their treatment closer to their homes. We already deliver some chemotherapy at the Newham and Whipps Cross hospital sites, but this is restricted to certain tumour groups only, and this could be expanded further in order that more patients can be treated locally rather than coming to the cancer centre here at Barts.
It's always possible for organisations to copy the best in other organisations, but bringing the organisations together gives us an opportunity to do that in a much faster and much shorter timescale and bring better services to people in East London. This will then end up as not only one of the biggest hospital trusts in the NHS, but one of the best.
At Newham, we ensure that all of an older person's needs are met when they come to hospital. So not just their medical needs, but also their social needs, their mental health needs, their psychological needs. Many of our staff are also trained to care for people with dementia and understand the needs of older people with other mental health problems. We're passionate about what we do, and we do it well.
There is good evidence to suggest that patients who attend specialist centres that have a high volume, that's a high number of patients going through them, have better outcomes. With a merger such as we propose, we will be able to create a number of large volume specialised centres and with it better outcomes for our patient population. This will mean that the patient will see the right specialist for them sooner by reducing the number of stops and other doctors they may have to meet before getting the correct treatment for them.
At Whipps Cross, the vast majority of patients get keyhole surgery for bowel cancer. We do that with an enhanced recovery programme which maximises pain relief after surgery, optimises their nutrition and gets them rapidly back to normal activities after surgery. This approach has been adopted by our colleagues at the other trusts, but the merger presents an opportunity for innovation to be spread throughout the organisation more rapidly.
I can't recommend the treatment I had at Whipps Cross more highly. In my case, I was up and about and home within 3 days. I would certainly recommend it for other people in terms of quick recovery and also mental well-being. I think it would be fantastic if this was available to other people.
The merger would mean that specialist treatment, currently only available to patients at a particular trust, will be accessible to far more people across the new organisation. For example, here in maternity, we're experts at managing a condition where the placenta stays stuck to the womb. It is rare but can be dangerous if not managed well. If we merge, we'll be able to offer treatment to women at a much earlier stage routinely, and that will avoid the need to be transferred to the Royal London Hospital in an emergency after the baby's born.
Research is important across all areas of clinical medicine, particularly TB. Tuberculosis is a serious problem in East London, and cases have been increasing over the last 20 years. With the merger of the three trusts, there'll be a much bigger patient population. That should give us much better opportunities to do better quality research across all areas of medicine, particularly looking at prevention of illness, but most importantly of all, looking at better ways of treating patients.
I think the merger will bring tremendous opportunities for nursing and nurses across all of the hospitals, because it will bring a variety of skills across specialist areas and general areas, encourage nurses to advance their practice. We have enhanced roles that we can develop into new ways of working, and they'll have the opportunities to develop managerial skills and really enrol into clinical academic pathways, which the end point is that we can deliver excellence to all of our patients, both in hospital and in all of the communities.
For almost 2 centuries, poverty has meant that life expectancy here in East London has been among the lowest in the country. The people of East London deserve better. Our vision, a vision shared passionately by clinicians across all 3 trusts, is that we can change that by working together. And there's good news on the horizon. We're seeing massive regeneration in our area thanks to the Olympics. We have the £1 billion investment in world-class new hospitals at Barts and here at the Royal London, not to mention new investment at Whipps Cross and Newham. We will soon have the new healthcare facilities we need in East London. Now we need to turn our attention to how we organise the way we deliver our care. By coming together, we will have an opportunity not only to protect vital local health services, but to build a brighter and a healthier future for all the people we serve.